Welcome to the eCancer Roundup for October, and here we are in ESMO. This is my 47th ESMO. The team have produced an extraordinary number of really good, insightful videos. I think they're approaching 50-something as we speak, with all the key opinion leaders who really matter and who've really brought important stuff to the ESMO conference. This will also be my last eCancer monthly report, because I'm stepping down as editor, and I'm looking forward to handing over to a younger variety, and that will be probably in the next couple of months, before Christmas, probably something like that. So today we've got not just all these wonderful videos from ESMO for you to see, but also a really, really interesting topic, which is actually at the top of the ESMO list of guidelines, that is biosimilars. So eCancer has also got ahead of the game with biosimilars, and we've published 3 days ago maybe, a beautiful educational module which is really explaining to all clinicians what are biosimilars, are there risks, are there? The answer is they're very similar to ordinary drugs, if not identical, and therefore as they deliver $2 billion savings on a $20 billion European healthcare budget for cancer, 10% savings is certainly worthwhile. So that's biosimilars education module. Go on to eCancer and put in the button. Just a few highlights as usual from across the world, which is really heartening because we are eCancer Global Foundation and we publish free, which is what it's all about. Knowledge should be free. The first one is really intriguing. It comes from Sao Paulo in Brazil, and it's about a carcinoid syndrome which produces carcinoid heart disease. And I actually don't think I know enough about that, so I read it very carefully. And the definition of carcinoid heart disease as a sort of bystander effect from carcinoid syndrome is patients who've got moderate or severe tricuspid or pulmonary regurgitation on an echocardiogram. There's a retrospective study done by the Camargo Cancer Center. They produced 38 patients who have carcinoid syndrome of various kinds, defined by the usual markers, urinary 5-HIAA, and they found, to my astonishment certainly, that 38% of these patients had got heart side effects from the carcinoid itself, not from any treatment for the carcinoid. So I thought this was an important pointer for those of you who treat carcinoid, and not many of you will see more than one carcinoid patient in a year or in 2 years, but it's worthwhile checking for tricuspid incompetence and pulmonary regurgitation, because that might often give you as many side effects and off-target effects as the carcinoid syndrome itself. Nice paper from Singapore about what patients want in the way of information, and this team designed a very good set of scales and came up with common sense results, with a vast majority of patients supporting the 3 or 4 things which clinicians as old as me will know all about. And they include what diagnosis is going to do next, what's the test do, what do you do with the test, what's the consequence of the test, need I have the test, all about what kind of treatment will then happen, what will happen then, what are the side effects, am I going to live, am I not going to live, what's the psychosocial problems, what's the problem with money at home, problems about sexuality, that sort of thing. A really nice piece of work from Singapore. And then another extraordinary and innovative piece of work from Durban in South Africa. So we really are covering the globe. And this was a meeting of the International Children's Palliative Care Network. I have the most fantastic respect for pediatric oncologists. I really don't know how they maintain their sanity, and people who are looking after children's palliative care must have a bigger job and a tougher job. And this was a super meeting. There's lots of inspiration came out of it, lots of innovation, and lots of integration right across the globe. I urge you, if you treat cancer patients who are in the children category, please have a look at it. And then lastly, an interesting paper from Chile. And this is just a kind of paper we want. We want to have all the studies which come in and which may have disappointing results. Negative studies don't tend to get published. That's a terrible miss. So here's not a negative study, but it's not a big breaker for the plenary session at ESMO. Regorafenib has been looked at in chemoresistant metastatic colorectal cancer patients, and it's a small series with about 13 patients and one response with very little side effects. So please, let's have your data, no matter how small, as well. The studies are properly done and report negative studies or near negative studies, as is this one. So that's it for me. Thank you very much to everybody who supported eCancer and me personally and the team here over the last decade, when I think we've achieved some near miracles. We're many millions of people who come into eCancer now, and we are very grateful to them. As I said before, knowledge is free. eCancer Global Foundation is the new charity in the UK which is responsible for publishing the journal, and the chairman of the trustees may well be known to you, Professor Richard Sullivan, who's in charge of the Institute of Global Cancer Policy in King's College, London. I wish Richard all the best, and thanks again to the whole team at eCancer for really doing a remarkable job over the last decade or so, and I'm sure the journal will flourish. Thanks again.